Welcome to CTV News Trendline with Michael Stittle and Nick Nanos.
You know, from a polling perspective, when we look at the trend line and the proportion of Canadians that identify healthcare as their top unprompted national issue of concern, well, check out the trend line at least back to 2005 up to present. And, you know, you can see that right now we're at a high, even higher now than it was during the pandemic, where Canadians identify healthcare as their top unprompted national issue of concern. So this is on the radar, but it's kind of like Groundhog. You remember Bill Murray's Groundhog Day, where you wake up and he smashes the alarm clock? Well, it's healthcare is kind of like that. It's like every day we wake up and it's like we're repeating and having the same issues, the same stresses that we had before. But now, to Avis's point, in this post-pandemic world, it seems to be becoming more intense. What I'll say, the pressure on the system. And I think many Canadians are outright questioning how resilient is our healthcare system in meeting our demands. And I think when they're asked that question, they're like, I'm not really sure how ready, prepared, or resilient it is.
Yeah, absolutely. Just to follow up, I sense a lot of anxiety. The sense is that the healthcare system won't be there when they need it. So where do you go if you don't have a doctor? You go to emergency. When you go to emergency, what's the average wait time? 22 hours. Wow. When you look across the board, 22 hours. Canadians know that there's a trade-off when it comes to healthcare. Everybody gets it, but everybody kind of waits. And they understand that. But 22 hours with rural emergencies closing where they have no doctors and walk-in clinics, it's just too much. And so you have people who have been in lockdown and everything who are now anxious about healthcare. And that's, I think, Nick, what's being reflected in your poll. People are worried. Maybe it's not there for me when I need it.
Yeah. At the same time, they don't know what the solution is, Avis. Right? They know it's complicated. They know it's not necessarily throwing money at it, which creates another level. It's not like a lot of other public policy issues. And why don't we just use the pandemic as an example from an economic perspective? It's like, okay, so people might not be able to go to work. Businesses might be in stress. Let's spend stimulus and send checks to people. That's a lot easier than the healthcare system, which is much more complex. And I don't think Canadians are waiting to hear solutions, but I think we're not hearing a lot of solutions, at least from a lot of our political leaders.
I mean, you've both touched on this. This is at the center of it is a political dispute, let's say, from the federal government and the provinces. That there's a huge fight on right now. They can't come up with a deal. One side's blaming the other, and I don't see Canadians having a lot of faith because, as we all know, this has been a fight that's been going on for pretty much as long as we've had healthcare.
Well, I'd like to say, Michael, that the provincial governments position it as a fight. It's not a fight. Canadians want universal healthcare. They want reasonable delivery. They want preventive healthcare, which is what we've been sold on. But what I've noticed over my years of doing it, and most of my focus has been on health developments and health science. But as an outside observer, what's become very clear to me through my 30 plus years and the pandemic is that the provinces are all doing their own thing and things don't line up. And they're doing things for political expediency over the best interests of the public. I was at dinner with a healthcare worker at one of the hospitals, and she said, absolutely, every 4 years, it changes. The direction changes. Oh, we're going to privatize this. Oh, we're going to privatize long-term care and different things. So I think the public is confused and angry, and that leads to the anxiety. We can go into this, but, what do you think, Nick?
Yeah, I would agree. And, you talk about, privatization and long-term care facilities. In research that we did during the last provincial election in Ontario, and we asked Ontarians during the election, and this was for the Globe and Mail, how they'd like to fund long-term care facilities or help on that front. 74% said increase public funding to long-term healthcare facilities, while only 14% said that they would encourage more private sector type stuff. And what the survey shows is that people overwhelmingly just want to make sure that the public system is properly funded, that it can hire the people that we need. It's kind of a bit of a truism where you kind of, if you don't have enough people, it would be like if this was a business it would be like saying, I don't have enough employees and I need to change my business model, when the reality is you just need the employees to do the work and to deliver the services to customers. So, I think that the first step in kind of dealing with this crisis is talking about how many beds do we need? How many nurses, how many frontline healthcare workers are actually needed for the public healthcare system to deliver what it needs to deliver? And we've never talked about that. It's like they start going to kind of other options as opposed to focusing on the people in the system.